Amy, I'm Shannon. I'm a nurse practitioner student at US University. And do you consent to me taking this video, uploading it on YouTube as an unlisted video for my teacher's degree?
Yes.
Great, thank you so much. So I'm going to be starting my cardiovascular assessment today. I'm going to go ahead and wash my hands and begin my assessment by taking blood pressures in both arms, and while she is sitting and while she is laying down, to compare the two. So I'll go ahead and I've done the blood pressures. I'm going to have her lay down at a 30 to 45 degree angle. Thank you, Amy. And I'm just going to allow her to be comfortable laying at a 30 to 45 degree angle. I'm going to first start off my assessment with inspecting her external jugular vein. I'm going to have her turn her head to the left a little bit so that I can visualize the vein, or the artery. So the external jugular vein, and I see that there's no distension. I'm also assessing for pulsations of the internal jugular vein. And I'm going to be assessing the pulsation, which I do see on her neck that is right above the clavicle. So once I note the pulsation, I'm going to measure the jugular vein pressure. And I'm going to take a straight edge, and I'm going to place it on top of the pulsation. And then I'm going to measure in centimeters down to the sternal angle. And once I measure that, it measures 2 centimeters. And anything under 3 centimeters is within normal limits. So that is good. Next, I'm going to be palpating the carotid. So I'm going to go ahead and palpate on one side only. And I'm just palpating for a brisk upstroke for no thrills, which I do not feel. There is a brisk upstroke. I'm going to go ahead and palpate the left side for brisk upstroke, which I do feel, and no thrills are noted. So I'm going to auscultate the carotid as well. So I'm going to take my stethoscope, and I'm going to listen with the bell and the diaphragm for any bruits. So I'm going to go ahead and with the bell, I'm going to listen on the right side, and then with the diaphragm, and I do not hear any bruits. And I'm going to go ahead into the left side of the carotid, and I'm going to listen for any bruits with the bell and the diaphragm, which nothing is heard. So that is a good sign. I'm going to go ahead and move on to the assessment of her chest. I'm going to look for her sternum. I'm going to make sure that her sternum is midline. I'm going to be assessing for any kind of for any abnormalities in her chest wall. I'm also going to be looking for pulsations, the ventricular pulsations, the precortical pulsations, precorticoid pulsations, and apical impulses. And there's none visualized. I'm also going to assess her abdomen for aortic pulsations, which are none is visualized as well. Sometimes pulsations on the chest can be visualized with those who have a decreased muscle mass or who are very skinny. I'm going to go ahead and palpate, and I'm going to be palpating all the areas that I will listen to the heart. So the aortic, which is on the second intercostal space to the right of the sternum. So I'm going to palpate that area. Then I'm going to move over to the pulmonic, which is the second intercostal space to the left of the sternum, down to Erb's point, which is third intercostal space, tricuspid, which is fourth, and I'm going to palpate the fifth intercostal space. And what I'm trying to feel for is any kind of lifts, heaves, or tenderness, and I do not note any tenderness on her abdominal or chest wall. And now I'm going to go ahead and proceed to palpating the point of maximum intensity or impulse, and that is going to be on the fifth intercostal space in the midclavicular line. And I'm going to go ahead and try to palpate for a small brisk pulsation. And if I don't feel any, I'm going to have her lay on her left side. So go ahead and lay on your left side, Amy. And I'm going to continue to feel for the pulsations. And I do feel that is brisk and small. All right, come on back. Thank you so much. I am now going to palpate for her aorta in her abdomen. So I'm going to palpate for the pulsation of the aorta. And I do feel it. And there is no thrill. And it is a +2 in grade. So that feels great. And I'm going to move on to the femoral arteries. So I'm going to palpate for the femoral artery arteries in her in this area, and I would normally do it on bare skin, but since we're not in clinic, I'm just going to do it with pants on. And I do feel her femoral pulses. There's no thrill, and they are a +2. So I'm going to move on to auscultation. So when I'm auscultating, I'm going to be auscultating for any skipped beats, any extra beats, any murmurs, and I'm also going to be just assessing for any kind of S2 splitting. And so I'm going to palpate or auscultate with the bell and the diaphragm of my stethoscope while she's laying and while she's sitting. So I'll go ahead and start in the aortic, which is the second intercostal space right of the sternum. And I'm assessing with the diaphragm and the bell to hear if there's any abnormal heartbeats, any murmurs. I'm moving over to the pulmonic. It's the second intercostal space left of the sternum. And I'm listening with diaphragm and bell. I'm going to go to the Erb's point, which is third intercostal space, to the left side, and listening with both diaphragm and bell. I'm listening at the fourth intercostal space on the left side, and that is also the tricuspid valve. And then I'll listen to the mitral, which is the fifth intercostal space on the left of the sternum, with both the bell and the diaphragm. I do hear an S1, ST2, and no abnormal heartbeats, skip beats, or extra beats, or murmurs. And I'm going to go ahead and actually assess for S2 splitting, which basically means that when she inhales, the pulmonic and the aortic valve are going to close at slightly different times. So I'm going to go ahead and assess that now, and I'm going to have her take a deep breath as I listen. So I'm going to listen on the left side, and I'm going to have her take a deep breath. Go ahead, Amy. Okay, take another deep breath. Alrighty, and then I do hear the S2 splitting, and that is a normal finding. Alrighty, and I'm going to do another listen with you sitting up. And now, as she sits up, I'm also listening for any increased murmurs. Sometimes you can hear them when a patient is sitting up or upright. So I'm going to listen again in the aortic and the pulmonic. And I'm going to use both the bell and the diaphragm. And then the Erb's point, tricuspid, and the mitral. Alrighty. And again, there's no abnormal heart sounds. S1, S2 were heard distinctly, and no murmurs were noted. So I'm going to have her lay back again. And now I'm going to listen to her abdominal aorta, and I'm listening for any breweries. And I'm going to listen with the bell and the diaphragm on my stethoscope for any breweries. So I'm going to go ahead and start at the aorta. And I'm listening. No breweries are noted. I'm going to move down to the iliac arteries. And no breweries are noted. And I'm listening again with both the bell and the diaphragm. I'm going to head over to the renal arteries. And then I'm going to listen to the femoral arteries with the bell and the diaphragm. All right, and no breweries are noted in all areas, in all arteries. And I'm going to move on to the peripheral vascular assessment. And I'm going to be assessing her skin color, whether it's pink. I'm going to be assessing the warmth of her skin. I'm going to be assessing for any kind of edema, cyanosis, any kind of vein. For the cyanosis, for varicose veins, for any shunting of sorts. So I'm going to start with her upper extremities, and I'm just feeling for warmth and edema. And then I'm going to take a look at her fingernails as well, and I'm just looking for any cyanosis or splinter hemorrhages. I'm looking for any tar discoloration, and I'm going to do a tap refill on both sides. So anything under 3 seconds is within normal limits. And I'm going to go ahead and cap refill. And I'm assessing as well for any cyanosis, splinter hemorrhages, or edema, or tar discoloration. And none is noted in both bilaterally, both fingernails. I'm going to assess for her radial pulses bilaterally as well. And I do assess them. They are +2 with no thrill. I'm going to move up to the brachial pulses bilaterally. And they are +2 as well with no thrill. And then I'm going to move to the lower extremities. So I'm just going to assess again the warmth, the color, for any edema, varicose veins, or shunting. I'm going to look at her skin. And I'm going to go ahead and assess for the popliteal pulses underneath her knee. And I do feel those. Those are +2 with no thrill. And I'm going to go ahead and do her left leg as well. And that is a +2 with no thrill. And then I'm going to move on to her dorsalis pedis pulses. And I'm, again, assessing. They are a +2 with no thrill. And then I'm going to be doing her posterior tibial pulses. And they are also a +2 with no thrill. And then, again, I will also assess her toenails for the cap refill. I will be assessing if they're under 3 seconds. And then I will also assess for any cyanosis, splinter hemorrhages, or tar discoloration. So that is completing our cardiovascular assessment. So thank you very much.